Across evolutionary history, the human metabolic system adapted to thrive on diverse nutrient sources. Today, emerging nutritional science highlights how low-carbohydrate, nutrient-dense foods influence long-term metabolic health. Rather than simply limiting glycemic spikes, exceptional low-carb staples, such as wild salmon, eggs, extra virgin olive oil, walnuts, avocados, dark leafy greens, cruciferous vegetables like broccoli and cauliflower, berries, and plain Greek yogurt supply rich concentrations of essential fatty acids, polyphenols, and bioavailable micronutrients. Modern clinical research indicates that integrating these 10 foods into balanced dietary patterns may support mitochondrial efficiency, reduce systemic inflammation markers, and enhance overall metabolic flexibility. However, understanding their true value requires looking past basic macronutrient counts to examine the complex biochemical pathways that govern cellular longevity and immune defense. At the cellular level, these 10 low-carbohydrate foods provide specialized compounds that modulate metabolic and immune pathways. Omega-3 fatty acids in wild salmon and walnuts may support lipid signaling and help suppress pro-inflammatory cytokines through NF-kappa B pathway regulation. Monounsaturated fats in extra virgin olive oil and avocados contain oleic acid and oleocanthal, which research suggests may preserve vascular endothelial function. Furthermore, sulforaphane in broccoli and glucosinolates in cauliflower stimulate NRF2 transcription pathways, promoting endogenous antioxidant enzyme production. Phytochemicals, such as anthocyanins in low-sugar berries, interact directly with gut microbiota, yielding metabolites that appear to bolster gut barrier integrity. Simultaneously, bioavailable protein and zinc in eggs and Greek yogurt support cellular repair and immune cell proliferation, demonstrating a multifaceted biochemical synergy. Evaluating human clinical evidence requires distinguishing between observational data and randomized controlled trials. Large-scale prospective cohort studies have consistently associated Mediterranean and low-carbohydrate dietary patterns, rich in olive oil, nuts, and leafy greens, with reduced cardiovascular risk markers. Randomized controlled trials in adults with metabolic risk factors indicate that replacing refined carbohydrates with nutrient-dense fats and protein may improve glycemic control, insulin sensitivity, and lipid biomarkers, such as HDL cholesterol and triglyceride ratios. Additionally, human clinical trials investigating polyphenol-rich low-carb foods suggest potential improvements in vascular reactivity and markers of oxidative stress. However, while preclinical laboratory and animal models show compelling cellular longevity pathways, human trials remain nuanced. Clinical outcomes vary based on individual baseline health, dietary adherence, and total lifestyle context, rather than single isolated ingredients. While these low-carbohydrate foods offer substantial nutritional density, scientific rigor requires acknowledging individual variability and metabolic context. Bioavailability of key nutrients, such as fat-soluble vitamins A, D, E, and K, depends significantly on meal composition and digestive health. Moreover, dietary responses differ based on genetic factors, physical activity levels, baseline insulin sensitivity, and gut microbiome diversity. Overemphasizing any single food while ignoring overall calorie balance or broader lifestyle factors can yield suboptimal results. Furthermore, long-term observational studies indicate that the overall quality of the diet matters far more than extreme carbohydrate restriction alone. Individuals with specific clinical conditions, such as advanced kidney disease or hyperabsorptive lipid profiles, require personalized medical guidance. Sustainable health improvements stem from holistic, balanced dietary patterns tailored to individual physiological needs. In summary, incorporating nutrient-dense, low-carbohydrate foods, such as fatty fish, olive oil, leafy greens, cruciferous vegetables, nuts, and berries into a balanced routine may support metabolic resilience, immune function, and overall longevity. However, no individual food acts as a standalone solution. Optimal health relies on sustained dietary patterns combined with regular physical activity, restorative sleep, and effective stress management. Rather than pursuing short-term restrictive trends, long-term well-being is cultivated through consistent, evidence-based lifestyle choices. Disclaimer: this documentary is for educational and informational purposes only and does not substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider regarding personal health conditions.